Borderline personality disorder is one of the most controversial diagnoses in psychology today. It is a serious mental illness characterized by pervasive instability in moods, interpersonal relationships, and behavior. This instability often disrupts family and work life and long-term planning. This disorder was once believed to be at the borderline of psychosis. Borderline personality disorder affects 2% of adults, being mainly young women. Patients with borderline personality disorder often need extensive mental health services, and they account for 20% of all psychiatric hospitalizations. Although BPD is such a serious condition, many patients can improve over time and can be on their way to living a fairly normal life. People with borderline personality disorder often feel insecure with who they are. Their self-image rapidly changes, and they view themselves as evil or bad. Sometimes they feel as if they don't exist at all. This often leads to changes in jobs, friends, goals, and values. Relationships are often at risk. They often experience a love-hate relationship with others. They may idealize someone one minute and then hate them the next, over perceived slights and misunderstandings. People with this disorder can only see black and white, and they cannot see the gray areas. Other symptoms of borderline personality disorder include impulsive and risky behavior, strong emotions that wax and wane frequently, intense but short bursts of anxiety and depression, inappropriate anger that sometimes leads into physical confrontations, and difficulty controlling emotions, suicide behavior, and fear of being alone. Adults with borderline personality disorder often have a history of childhood traumas including physical, sexual, and emotional abuse, and/or neglect or loss of a parent. Feeling of self-loathing that arises from these situations are key in developing borderline personality disorder. In most cases, patients with BPD still have suffered from post-traumatic stress disorder prior. There is also research that shows changes in certain areas of the brain that are involved in emotion and regulation, impulsivity, and aggression that can also cause borderline personality disorder. There are several treatment options for people with borderline personality disorder. Psychotherapy allows a patient to talk about their past experience and present experience to a therapist. Therapy has to be structured, consistent, and regular. Sometimes medications such as antidepressants, lithium, and any other antipsychotic medication can be useful for certain patients. Borderline personality disorder is one of the most common and most misunderstood of the serious mental health disorders. People living with borderline personality disorder are often avoided by treatment providers. Unlike other serious mental health disorders, recovery is usually stable. Families play a crucial role in supporting their affected loved ones that have borderline personality disorder. Given time, any borderline personality disorder patient can start on a slow road to recovery.